Hello and welcome. Today we'll be discussing a serious complication of chronic ear disease called Labyrinthine Fistula, specifically when it's caused by erosion from a cholesteatoma. This is a condition that can significantly impact hearing and balance, and understanding it is crucial for timely intervention. Labyrinthine fistula in the context of cholesteatoma arises from the relentless erosion of bone by this abnormal skin growth in the middle ear. A cholesteatoma isn't cancer, but it's aggressively destructive. It often starts as a retraction pocket in the eardrum, where skin from the outer ear invaginates into the middle ear. Over time, this pocket accumulates dead skin cells and debris, forming a growing mass. As the cholesteatoma expands, it secretes enzymes that erode the surrounding bone, including the bony labyrinth of the inner ear. This erosion can then create an abnormal opening, or fistula, between the middle and inner ear. Now let's dive into the pathophysiology. The inner ear or labyrinth is a complex system responsible for both hearing and balance. It contains fluid-filled chambers and delicate sensory hair cells. When a cholesteatoma erodes the bony labyrinth, it disrupts the normal pressure regulation within the inner ear. This disruption leads to abnormal stimulation of the sensory hair cells. Pressure changes in the middle ear, such as those caused by coughing, sneezing, or even loud noises, can then be directly transmitted to the inner ear through the fistula. This abnormal stimulation triggers a range of symptoms, including vertigo, hearing loss, and tinnitus. The extent of the symptoms depends largely on the size and location of the fistula, as well as the individual's sensitivity to these changes. While precise epidemiological data is limited, labyrinthine fistula secondary to cholesteatoma is considered a relatively rare complication of chronic otitis media, particularly chronic otitis media with cholesteatoma. Individuals with a history of recurrent ear infections, persistent ear drainage, or a known cholesteatoma are at a higher risk of developing this condition. Early detection and appropriate management of cholesteatoma are key to preventing this complication. The signs and symptoms of labyrinthine fistula can vary in severity. The most common symptom is vertigo, a sensation of spinning or dizziness, which is often triggered or worsened by changes in middle ear pressure. This can be induced by things like sneezing, coughing, straining, or even just touching the ear. Patients may also experience hearing loss, which can be progressive and may involve both conductive and sensorineural components. Tinnitus, a ringing or buzzing in the ear, is another frequent symptom. In some cases, patients may also report imbalance, nausea, and vomiting, particularly during episodes of vertigo. A hallmark symptom is Hennebert's sign, which is vertigo or nystagmus induced by pressure changes in the ear canal. Diagnosing labyrinthine fistula requires a thorough otolaryngological examination. This includes a careful examination of the ear canal and eardrum, often using an otomicroscope. Audiometry, or hearing testing, is performed to assess the type and extent of hearing loss. Vestibular testing is crucial to evaluate the function of the balance system and identify any abnormalities. A CT scan of the temporal bone is typically ordered to visualize the extent of the cholesteatoma and the presence and location of the fistula. MRI may be used to rule out other causes of vertigo or hearing loss and better define soft tissue involvement. Fistula testing involves applying pressure to the ear canal and observing for eye movements, and nystagmus or vertigo helps confirm the diagnosis. While there aren't distinct classifications of labyrinthine fistulas caused by cholesteatoma, they can be categorized based on their location within the inner ear. The most common site is the lateral semicircular canal, but fistulas can also occur in the superior or posterior semicircular canals, or even in the cochlea. The size of the fistula also influences the severity of the symptoms and the approach to treatment. The primary goal of treatment is to surgically remove the cholesteatoma and repair the fistula. This usually involves a mastoidectomy, a surgical procedure to access and remove the cholesteatoma from the mastoid bone. The fistula is then repaired, often using bone pate, cartilage, or soft tissue grafts to seal the opening. In some cases, a tympanoplasty or eardrum repair may also be necessary. Post-operative care includes antibiotics to prevent infection and close monitoring for any signs of recurrence or complications. Rehabilitation may involve vestibular therapy to help improve balance and reduce vertigo. While preventing labyrinthine fistula directly is difficult once a cholesteatoma has formed, early detection and treatment of chronic otitis media and cholesteatoma are paramount. Regular ear examinations, particularly in individuals with a history of ear infections, can help identify cholesteatomas early on. Prompt treatment of ear infections and appropriate management of cholesteatomas can significantly reduce the risk of developing this complication. The prognosis for patients with labyrinthine fistula depends on several factors, including the size and location of the fistula, the extent of the cholesteatoma, and the success of surgical intervention. While surgery can often successfully repair the fistula and prevent further progression, some degree of hearing loss or balance problems may persist. Recent research focuses on improving surgical techniques for fistula repair and developing new strategies to prevent cholesteatoma recurrence. Advances in imaging technology are also helping to improve the accuracy of diagnosis and surgical planning. Ongoing research explores the potential of regenerative medicine to restore inner ear function following damage from cholesteatoma and fistula formation.